So let's jump on to the classification of the suture material. So this lecture I do not want to be too much theoretical, because theoretical lessons get boring, but I want to give you this much theory that if you want to go and refer to it, you will be able to learn from it. And secondly, a little bit of the theory is really required when you are, even when you are working in totally practical scenarios, because unless and until you know about your material, what kind of material it is, what are the different properties of the materials, how can you use it effectively in the oral cavity? So if you find it little boring, you can jump the video, but I would suggest you at least go through it once, so that you know that what kind of materials are preferred in oral cavity and why. And so let's jump on to the classification of the suture material. So suture material can be natural. These are the examples are gut, chromic gut. We will discuss these sutures later on. And the synthetic, which we most commonly use these days, because anything which is synthetic we can make it according to our own preferences. And the metallic sutures. So metallic suture we do not use in the oral cavity. These are mainly used for the skin, and I don't think anybody uses them now. So mainly we'll be focusing on these two sutures, natural as well as synthetic, as long as the oral cavity is concerned. So you should always prefer these synthetic sutures, because there are a lot of good options available in these synthetic. So natural, I have used a lot of natural suture materials in my career, and I will tell you what I faced and how were they. And so we can divide the suture material according to the structure also. Initially we divided them according to the material. Now we are dividing according to the structure. So this is a monofilament suture material, means suture material is made up of one single filament. And the other is the multifilament. So multifilament can be stacked like this, or they can be braided. Can be braided or they can be stacked. Okay, so these are the two, they are the classification according to the structure. And then according to the fate, this is really important for us, because the first is the absorbable and then comes the non-absorbable. The absorbable sutures, what happens with the absorbable suture is they undergo degradation and they lose their tensile strength, and they get slowly resorbed by the body. Non-resorbable sutures, they maintain their tensile strength and their material is such that it cannot be resorbed by the body. So this is again another classification. Other classification is coated and uncoated. We will see, I'll show you different suture materials in the upcoming presentation, that what are the coated and what are the non-coated material. Coated materials, for example, vicryl material is coated with a different kind of antibacterial agents, so that it is more effective in the oral cavity. And then braided and twisted, so either they are twisted like a rope or they are braided. So you just remember it. Mostly we use synthetic sutures, mono or multifilament, and resorbable or unresorbable, that is your choice. So what exactly is the absorption? So absorption can happen enzymatically, as with catgut, or hydrolytically, as with absorbable synthetic polymer materials. So absorption means, when we are talking about absorbable suture material, if we are talking about natural suture material, which are the catgut, since it is natural, so body is managing it with enzymes, because this is a protein. So anything which is protein in nature, it has to be managed enzymatically, and anything which is synthetic in nature, it will be managed hydrolytically. So you should be able to know that if you are using some kind of synthetic material, synthetic suture material, how body is tackling that synthetic suture material. So body absorbs that synthetic material hydrolytically. And what is the absorption time? Okay, so absorption time or half-life. which is defined as the time required for the tensile strength of the material to be reduced to its half. Means if I am putting a suture material into the oral cavity and my healing time is around 10 to 12 days, suppose, I don't want my suture, any suture whose time half-life is just 2 to 3 days, and within 2 to 3 days it will lose its tensile strength and it will be of no use to me. Okay, and I want a suture material which has a half-life of at least 8 to 10 days, so that by the time I remove my sutures, they have, still have some kind of tensile strength left with them. So the choice of the absorption suture material will also depend upon this factor. So what is the dissolution time? Dissolution time is the time that is when a thread is completely dissolved. So there is a very common problem I face in my practice, or anybody faces, that patients ask me what kind of sutures are you going to place, because they ask me whether you are going to place the resorbable sutures or unresorbable sutures, because according to the general mindset, people think that resorbable sutures are better than non-resorbable sutures. These time influenced by a large number of factors, including thread thickness, type of tissues. So you have to just remember one thing, that this dissolution time should not match with the time that you want to keep your suture material inside the oral cavity. Suppose you want to keep it for 7 to 10 days. The suture will not get resorbed in 7 to 10 days. So this is the important information that you need to keep in your mind before selecting any kind of suture. So how will you select a suture in general? You will select it according to the rate or the healing of the tissue. That means if the suture if the tissues are healing slowly, you need a suture which retains its tensile strength for a longer period of time. Suppose if you are suturing the skin, it should retain its tensile strength for say 2 to 3 weeks period of time. But if you are suturing in oral cavity, 7 to 10 days are enough. So tissue contamination. So if the tissue is extremely contaminated, you cannot use multifilament because they have the high capillarity action. You have to use the monofilament sutures. Okay, and also according to the cosmetic results. Suppose if you are working in a cosmetic area, you are there is a laceration on the skin of the of the patient, on the face of the patient, then you have to use thinner sutures, and maybe 50 sutures or 60 sutures types. So accordingly you will choose your sutures. So what kind of sutures? So this is the most important question for us. Which kind of sutures are best for the dental practice? So I personally prefer using absorbable sutures in my practice. You can also use non-absorbable sutures for routine dentistry, either monofilament or multifilament. But absorbable sutures, all absorbable sutures, they get resorbed in approximately 1 to 2 months. So I cannot leave my sutures for that long into the oral cavity. So they have to be removed. So they have to be removed after few days, right? So this you should convey to your patients that even if I am putting the absorbable sutures, this has to be removed after a few days. You can also choose to put non-resorbable sutures and you can remove it later on. So that will be totally your choice. I'll be giving you certain scenarios where you can put different sutures as per the procedure that you are doing. Suppose if you are doing implants, if you are doing any other kind of surgical procedure, you can use those sutures which are recommended for that area. But again, by your own practice, by your own experience, you can change the sutures. You can also use the non-absorbable sutures. Routine sizes that we use is 30, 40 and 50. 50 sutures are very rarely used, mostly in the cosmetic zone, upper anteriors. They can be monofilament or multifilament. They have to be removed. You cannot leave them, right? So 30 and 40 is what I use most commonly. 40 is my preference all the time. So guys, this is all about suture material. What exactly are dental sutures? In the upcoming videos, I am going to talk about different suturing techniques, different suture materials that are available in the market, what are the different suturing principles, suturing armamentarium. So stay tuned.